I wish to acknowledge the Duck and Jung people as the traditional custodians of the land on which I work. I pay my respects to the elders past and present and recognise the continuing connection and contribution to the land.
Welcome back to MatterofVax. I'm Steph O'Connell.
It's a fact that pregnant women may be more at risk of infectious diseases. It makes it a critical time for prevention. If you're planning a pregnancy, it's an important time to talk to your doctor about your immunity. Today, we're joined by Dr. Michelle Giles. Michelle Giles is an infectious diseases physician who combines her private practice with public hospital appointments at Alfred Hospital, Melbourne, Monash Health and Royal Women's Hospital. Dr. Giles provides specialist consultation in general infectious diseases, but particularly specialises in infections and pregnancy. She's a researcher and a professor with the Department of Obstetrics and Gynecology at Monash University and the Department of Infectious Diseases, University of Melbourne. It's quite a wrap. Welcome, Dr. Giles.
Thanks, Steph. It's lovely to be here and an absolute privilege to be able to talk to you today about something very close to my heart, but infections in pregnancy and particularly vaccines in pregnancy.
It can be a complicated time of life for everyone, can't it? If I was even thinking about planning a pregnancy, what should I be considering?
It's an exciting time. I've got two daughters myself, and I remember before I was pregnant, sometimes I think you can feel a little overwhelmed with all of the information out there. So, where to get reliable information from is really critical. I guess because of my background and because of my expertise in infections and in vaccination, I'm going to focus my response really on that. But there are a lot of different considerations to really make sure you enter a pregnancy as healthy as you possibly can. So that, in a general sense, includes things like diet and exercise. And if you have medical conditions, making sure that they're really well controlled. But if you're thinking about infectious diseases themselves and vaccinations, I think there's two really important things to mention. The first is chickenpox and the second is rubella. And the reason I mention those is because there is a vaccine against chickenpox and there is a vaccine against rubella. It comes in a combined vaccine called measles, mumps, rubella. But both of those vaccines are live vaccines. What we mean by a live vaccine is it actually contains, we call it an attenuated virus or a changed virus. So it's not something that makes you sick, but it stimulates your immune system. But we tend to want to avoid live vaccines in pregnancy. But if you don't have any protection or any immunity to chickenpox or to rubella during the pregnancy and you get those infections can cause quite serious implications for the baby. So, if you are planning a pregnancy and you don't know if you're immune to either of those infectious diseases, we would advise that you go to your primary care physician, your GP, for example, and be tested. You can have a simple blood test to check if you've got antibodies to either of those. And if you don't have any protection, it would be the best thing you can do is to get those vaccines at that time, because if you are pregnant, we wouldn't recommend it. And then you're susceptible to those infectious diseases during the pregnancy. So in terms of pre-pregnancy planning and vaccination, they would be the two that would be important to think about and to get addressed before you're actually pregnant. There's a couple of other infections that we test women for during pregnancy that are worth mentioning, because if you are diagnosed with either of these infections prior to pregnancy, there are things we can do to reduce the chance of them causing you any problems or your baby any problems in pregnancy. So, just to name two, one is syphilis. We've seen there's been a rise in syphilis infection in Australia and particularly in women, and that syphilis in pregnancy can have very severe implications for the baby. But it's very easy to treat with penicillin. So we don't have a vaccine for that. If you're going to your GP to be tested or to have a health check before you get pregnant, there are a couple of other things that could be tested for. And if that was found, could be treated before you're pregnant. The other infection that is important to know about is called CMV or cytomegalovirus. And the reason why it's good to know if you've been infected with that before pregnancy is because you can have a conversation with your doctor about ways to reduce your chance of getting exposed to that infection during pregnancy. And that infection, CMV, can cause disability hearing impairment and other problems in your baby. So there are a couple of things to think about prior to the actual pregnancy itself.
Once you've had your routine vaccinations, it's time to start thinking about how you protect yourself during pregnancy. What's your advice?
Yes, so when I think about vaccinations in pregnancy, I think about the mother and the baby. And it's a really unique opportunity, and actually, very few other situations in life where you can get a vaccine and protect yourself, but also protect your baby. So sometimes we talk about it as the 2-for-1 deal. So one vaccine actually does two jobs. And so the vaccines that we recommend in pregnancy currently are influenza, pertussis, also called whooping cough, and COVID-19. And each of those are given for different diseases, but also are given for different indications in terms of who they're really targeting to protect. So, influenza in pregnancy can be a very serious infection for the mother. We have women admitted to hospital every single year who are pregnant with influenza. I have had women admitted to the intensive care unit, and very sadly, we have seen women die from influenza who are pregnant in Australia. So it's a very real thing. But fortunately, we have a vaccine that's extremely safe in pregnancy. It's been used for decades in pregnant women, and we have an abundance of safety data that is very reassuring. And so we recommend that every pregnancy a woman has an influenza vaccine to protect themselves. But equally important, we have good scientific data that shows it also protects the baby in the first 6 months of life. So current influenza vaccines licensed in Australia are from 6 months of age up. So your infant in the first 6 months of life, the only way they can get protected from influenza is from the antibodies that the mother makes when she has a vaccine and crosses the placenta. So that baby is born with protection against influenza, and children are also very susceptible to severe disease from influenza. So the influenza vaccine in pregnancy is to protect the mother, but also to protect the infant in the first 6 months of life. And I think a lot of people understand that for whooping cough, but I think fewer people understand that that is also the case for
Yeah.
influenza. I think that's because historically we've promoted or recommended the influenza vaccine to protect women because we see women get very sick from it. But during pregnancy, a lot of women, their focus is very much on their baby and protecting their baby rather than themselves necessarily. And the data that shows the protection for the infants came after the data that was about protection for the mother. But we do have that now. And so the conversations that I have with women in clinic about vaccines, I make sure that they understand that, because I think women very much understand the whooping cough story, which is this is a vaccine. Many women don't end up in ICU from whooping cough during pregnancy like we can see with flu. But obviously, babies can get very sick from whooping cough and can die, and they're very susceptible in that first 6 months of life. So, women generally understand the motivation to get the pertussis or whooping cough vaccine is to protect their baby. But I think it's really important for them to understand that is the same rationale for influenza. And then COVID-19 is obviously a newer vaccine because of the recent pandemic. And we predominantly recommend that to protect the mother. And that's because we saw early in the pandemic that pregnant women with COVID got extremely sick. So again, admitted to intensive care unit, higher rates of preterm birth if they had COVID in pregnancy, and severe respiratory disease. But we also now have data that shows that the antibodies, it's not surprising, the antibodies that the mother makes to COVID vaccines cross the placenta as well, just like we see with whooping cough and with influenza, and that does protect the baby at birth. But fortunately, young babies don't get as sick from COVID as what we have seen with whooping cough and with flu. So the main reason we would recommend COVID vaccines in pregnancy is to protect the mother, not necessarily to protect the infant, like we discussed just previously with the influenza and the whooping cough. But you can see it can be a bit of a complicated space to understand the different vaccines, when they're recommended and why they're recommended. It's important to think through those things. But the main message also is that with the flu and whooping cough, you do need it every pregnancy to protect the infant. So even if it's been 2 years or 3 years since your last pregnancy, you don't have enough levels of antibodies usually And also with flu, the strains change from year to year. So it's good to be up to date with the most latest strain in that pregnancy. So when your baby's born, particularly if it's over the first 6 months of life is during flu season, those antibodies that you've generated, if you've received that vaccine, will protect that infant against this, hopefully the circulating strains, not what was circulating during your last pregnancy a few years ago.
So we talked about first preparing for pregnancy and how to ensure your immune system's prepared. Then we talked about how you prepare and prevent disease during pregnancy. So once the baby is born, what does mother and family do to prevent disease in the first few months of life?
The single most important thing to protect that baby comes down to the mother's choice about what vaccines she has during pregnancy. So, in fact, there's not a lot of additional protection afforded to that baby if the mother has been vaccinated in pregnancy by people who come into the house or have contact with the baby being vaccinated. So, as a grandparent, it would be good to be up to date with your vaccination. It's good for anyone living in the house, for example, if there's other adults who'll be caring for the baby to be up to date with flu vaccination. But being up to date doesn't have the same level of impact in protecting that infant that the vaccination in pregnancy does. So I think the most important message is actually vaccines in pregnancy, the importance of other people being vaccinated who come to the house is really much more in the setting of a woman who may elect not to be vaccinated in pregnancy, because then her baby will not be born with any protection of its own. So then it's a more important strategy for people to be protected to reduce the chance of them bringing in that infectious disease into the house, but it's not nearly as effective as the mother being vaccinated herself.
You are an incredibly experienced doctor, both in infectious diseases and obstetrics and gynecology. I imagine after all of these years of talking to patients that you have a long list of do's and don'ts that you like to share with your patients. What's top of those lists?
Do's and don'ts often reflect what I focus on. So if you ask a doctor who is a different specialty, they would probably have a different list. So I think you have to think about it in that context. But when it comes to getting clear advice, I think it's really important to think about who is your trusted source of information, particularly medical information in pregnancy. And I really love patients who do try and obtain information that's relevant to them and come with questions to talk about their concerns. So, what I would say is do find a trusted source, do write down your questions and what you're concerned about, and do have that conversation with your trusted source. Your trusted source may be your midwife, your trusted source may be your obstetrician, your trusted source may be your general practitioner. It may be someone else. The don'ts, I would say, is don't rely too much for medical advice on friends, family, and the internet, because one of the challenges with that is the reliability of that advice. And it's absolutely important to have these conversations with your family, but it's really important to understand where you get reliable information from and don't make decisions based on other people's experience. My advice would be to have your questions discussed with your trusted source and then make your decisions based on that rather than other people's advice and experience necessarily.
A minefield, isn't it? I wonder what the future holds for infectious diseases and pregnancy. Everyone I speak to about a particular disease relishes the idea that the future will be different and that it will be safer for everyone. What's the future got for pregnancy and infectious diseases?
I think that the future is positive. I think we have some really exciting work being done in vaccinations in pregnancy. And I'll mention two because there's a new vaccines on the horizon. And the first one is respiratory syncytial virus, also known as RSV. It's increasingly recognized as a reason for hospitalization in older adults. So RSV is a common disease and we have no effective treatment for RSV. So it's not like other infections that you can get a course of antibiotics for. and it causes quite serious disease. It can do so in young infants. There is a lot of work that's gone on trying to look at preventing serious disease in young children from RSV. And at the moment, there are two sort of broad categories of products that can help protect that infant. One is a vaccine given in pregnancy, and the other is what's called a monoclonal antibody that's given to babies when they're born. And both of those have been licensed in Australia. They've also been licensed in other countries, and important tool that can help protect that baby. So if we go back to maternal vaccination, this is potentially another vaccine that will be available for women to protect their baby in the first 6 months of life. So this is a bit like the whooping cough and the influenza story, where the vaccine given to the mother is mainly to protect the baby, because women generally don't have particularly severe disease from RSV. That is something that I'm sure for any women listening to this podcast who are planning pregnancy or are pregnant now or going to be pregnant in the near future, that will be a conversation that they will hopefully have with their maternity care provider about what options are available to them to protect their baby in the first 6 months of life against RSV. There's another disease in pregnancy, another infection that actually can cause very serious disease in infants called group B streptococcus, and it can also cause quite significant disease in mothers. This is a bacteria that women may have heard about or may know about, because during pregnancy, we recommend in many places around the country swabbing women, doing a vaginal swab to look for this bacteria. And we do that during pregnancy. And then some women we give or recommend antibiotics during labour to lower the chance of the baby getting this infection. It can cause meningitis, sepsis, and death, particularly in the first 7 days of life. So this is an important bacteria, and there are vaccines that have been developed for pregnant women to protect infants and also hopefully protect women against some of the complications that are related to group B strep. So this vaccine is also an exciting vaccine about to enter into phase 3 clinical trial. It's been shown to be very safe and produces good immunity. But the next stage with any vaccine development is a larger scale study in pregnant women to make sure that it's creating the antibodies that it needs to protect the infant, and that we accumulate more safety data. But this is really exciting because particularly in countries outside of Australia and low and middle income countries, there are many, many children and mothers die from this infection. And so it is an exciting future if we can develop vaccines that can protect against some of these very serious infections. So probably a couple of years away, but it's also important to realise what is on the horizon. So RSV, much closer, Group B strep or GBS, a couple of years into the future. The other one I should mention, just now that I'm talking about acronyms, I mentioned earlier CMV or cytomegalovirus. There is also a vaccine against cytomegalovirus. It hasn't been trialled in pregnancy, but it's currently in clinical trials. And so that's also another exciting vaccine, if it can be effective and it's safe, that it can be used to ultimately protect infants from the effects of cytomegalovirus infection during pregnancy.
Michelle, I'm flabbergasted sometimes when I talk to guests about the breadth of knowledge and the incredible experience. Absolutely no exception today. Pregnancy is a complicated time. If you've been planning a pregnancy, if you're pregnant, or baby's just about on the way, there's lots to learn with this podcast. Thanks very much for joining us. You've been listening to MatterofVax. You can hear more podcasts on this subject matter and see the video at www.ifa.org.au and hear more MatterofVax wherever you listen to your podcasts.
Immunisation Foundation of Australia. Supporting immunisation, saving lives.